Hi, Bill Doherty here, co-founder of the Doherty Relationship Institute. And I want to talk about leverage in couples therapy. What I mean by that is, like, how do we connect with them and have a sense we have traction, we're working on stuff together, there's movement. And one of the ways to get leverage and keep it is not going to sound like rocket science, but it's to find out what they want, what they came for, and then focusing there. And in fact, in the Doherty Approach, every session begins with a check-in and then what's your agenda for today to help you move forward. So I'm not only asking the first session what they want to get out of this, but I'm asking each time, what do they want to get out of this hour? And so I'm continually hearing what each person wants to get to move forward, okay? Now, again, that sounds, it may sound obvious, but I can't tell you how many case consultations I've been in over decades in which we're talking about a couple who's been in therapy for some time. The therapist is frustrated with the lack of progress and this movement here and the lack of movement there, pushback from the clients. And then I ask this question, and I don't ask it as a smarty pants question, but I kind of lose because I haven't heard in the presentation, what do they come in for? What do they want? What are their goals? Because what often happens is the therapist puts in goals. Like, I want this person to deal with their attachment issues from their past, their trauma from their past. I want them to be more emotionally intimate with each other. Just lots of things that we think they ought to be prioritizing, which may not be their priorities. And so one of the ways to enjoy couples therapy is to be working on the stuff that they want to work on. Now, of course, we bring subtlety to it. They may say, want to figure out how to do our finances better, and so you're not going to just be a financial advisor coach. You're going to dig under. You're going to dig under the problem that they present with. But you always have to come back to the problem they brought. Okay, and so I worked with physicians for many years, and the presenting complaint. What did in the notes, the first is subjective. What did the patient want? Okay, what's their subjective experience medically? What do they want? Okay, and you have to, a really good physician is going to make sure that they are responding to what the patient's complaint was. Even if they are opening up other stuff, they have to show how it connects back to what they want. It's something we can lose sight of because we have our models. We have our images of what a relationship should be. And our model and our images may not correspond enough to what they came in for and what they continually want. And that's why in my approach, I ask them every session what they want. So I'm not just, because that could change over time, what people want. But I want to stay continually up to date with what their goals are, and then I try to work my stuff in and around their goals.